Here's something everyone with tinnitus wants: to reduce the ringing sound faster and with less effort. So I created this video today describing evidence-based strategies that can help you get there. I'm going to first start with a story of one of our patients who worked with my team at Treble Health. His name is Steve. Steve is a pharmacist who lives in New York City, and he developed tinnitus that was accompanied with trouble sleeping, anxiety, stress. It wouldn't go away. He went to local doctors. He reached a dead end. Doctors didn't know what to do with him. They didn't know the root cause of his condition. He was online searching for answers. He went so far as to even try herbal supplements, but as a pharmacist, he knew they wouldn't work. So he was desperate. He was looking for help. And I actually got to meet Steve in person at our recent New York City event. So I got to shake his hand and look him in the eyes and fully hear his story. The big message from his story was that there is hope. This journey of tinnitus, it has significant ups and downs. But when you keep on moving forward, when you have the right tools and you use evidence-based strategies, you can get help. I'll feature 7 key points. And the first point is understanding tinnitus and the root cause. There are 3 common causes that make up about 80% of the subtype of tinnitus. So we use the term subtype or cause or root cause to explain that tinnitus is a symptom, and a symptom refers to a disorder that happens underneath it. So if tinnitus is the symptom, then what is the disorder? Okay, there is research from my colleague, Dr. Gollenhofen out of Germany, who is an ENT clinical doctor, and he determined that about 80% of tinnitus cases fall into these 3 common subtypes. They are, number 1, the central subtype, number 2, the cochlear subtype, and number 3, the somatic or somatosensory subtype. Finding the root cause is so important, right? When we can identify the root cause or multiple causes happening in your case, then we can direct your treatment accordingly. It's so important. Most people have this umbrella term of saying the tinnitus or this patient has tinnitus, but we need to get deeper and understand that tinnitus is a symptom. What's the underlying root cause? Those 3 subtypes are a great framework that apply to most of you who are listening. Let's jump to the second key point, which is that the evidence, because we're going to be stressing evidence-based protocols here on this video, the evidence supports mind-body exercises. Now, what does that mean? Well, I want you to create the environment so your brain, your nervous system, and your body can support this tinnitus treatment, can support the reduction of the sound. Because there is no surgery or medication that's going to cure your tinnitus. How we're going to do it is to promote this natural brain process called habituation. But it often doesn't just happen on its own. It needs to be induced through a treatment plan. What we need to do is we need to pair tinnitus treatment with other more holistic approaches as well to create this comprehensive approach. The evidence is supporting stress management and focusing on sleep as an important piece of this. The first thing I want to address in this key point, number 2, is mindfulness-based stress reduction. In 2015, through the Journal of Otology Head and Neck Surgery, they found that a mindfulness program led to decreased severity in tinnitus symptoms. That's consistent with the patients that I've worked with. I'm consistently surprised that those who are using mindfulness consistently, along with our treatment program at Treble Health, tend to have better results than those who are just using our core treatment program. So what does that mean? It means guided breathing. It means studying mindfulness. It means practicing it, incorporating it into your everyday. Essentially settling your mind, settling your body helps your brain habituate and reduce tinnitus over time. Point number 3 in this video that I want to discuss is sound therapy. How sound therapy works is that you use consistent targeted sounds that are played through your ears and through your auditory system at a level that's softer, quieter than your tinnitus. And what it does is it gives your brain something else to hear that's not the tinnitus. And over time, the brain learns that the tinnitus sound is not a threat. The tinnitus sound is not an actual danger. The brain is programmed through our evolution to be alert to soft sounds that it perceives as a threat. So for tinnitus to be dominating us, the brain is actually perceiving it as a danger. Just like the sound of rustling leaves could signify a dangerous animal or a snake. The sound of tinnitus it may have started relatively quiet, now it's more intense and intrusive. The brain needs to be deconditioned and reprogrammed to learn that the sound of tinnitus is not actually a threat in our environment, that's an internal sound. All right? And sound therapy is one of the best ways to do this, because when you have sound therapy on, it's a passive experience that happens in the background, and it's supporting our brain to decondition the tinnitus threat and get out of the fight or flight reaction to it. In 2020, the Journal of the American Academy of Audiology found that sound therapy, when combined with counseling, was very effective in reducing the perceived burden of tinnitus for most patients. So I wanted to bring that in to explain that sound therapy, not only being the most vetted clinical approach by audiologists and tinnitus experts like myself, but also validated here by this independent journal a few years ago as being effective in reducing tinnitus intensity. So definitely use sound therapy, and there's various levels of technology that you can use for that. There's different sounds you can choose. I'll link below to another video on sound therapy, or if you'd like to have a consultation with a doctor from our team, you can schedule a discovery call with Treble Health. I'll include that link right there where we can discuss some various options for sound therapy that we've had success with. So just click the link right above and you can schedule that consultation, and we'll have that call to help you out. Key point number 4 that I want to discuss now is cognitive behavioral therapy. Essentially, what this does is it helps you restructure your thoughts to promote neuroplasticity and habituation of tinnitus. Just like sound therapy and guided breathing, what cognitive behavioral therapy does is it creates the environment between your psychology system, your brain, and your body to reduce tinnitus over time. And it's often used alongside sound therapy, alongside mindfulness, alongside CBT for insomnia. The evidence does support that this is an effective therapy for tinnitus. In the Journal of Otology and Neurotology in 2020, they found that CBT, cognitive behavioral therapy here, is a tool that when tinnitus patients, folks who have the ringing in their ears or other noises, when they learn it and can practice it consistently over time, that it helps them reduce the intensity of tinnitus. Now, you might ask, Dr. Ben, what does that exactly look like? What that looks like is folks may experience a high awareness of tinnitus. So for example, it's common for people who reach out to me to say that I hear tinnitus all the time, 80%, 90% of my day. I can't stop thinking about it. It's pretty much always there. There's a few moments in the day where I can't think about it, but it's really always there. I'm almost always aware of it. Then they report, and my volume level is a 6 out of 10, right? So what CBT can do really well, along with these other strategies you're learning, is to reduce the awareness of tinnitus first, because that's faster to come down. The awareness of tinnitus first, how it impacts us, right? Because I actually have the sound of my breathing going 24/7, right? But I'm very rarely aware of it. Only when I put my attention on the sound of my breathing do I notice that sound. So we can elicit a similar response here with tinnitus by using these strategies, and the awareness of tinnitus will come down first. What comes down after may be the volume. That doesn't happen for everyone, but it's more common than you think. Hey, just a quick interruption. Do you live in Northern California? Because on May 9th, I'll be in person in San Francisco for a live Treble Health event. As you can see on the screen here, our last event in New York City was such a success. So I hope to see you there. Check the link on the screen right now where you can reserve your spot in San Francisco on May 9th. I really hope to see you there. Key point number 5 that I'd like to discuss is hearing technology. It turns out that treating hearing loss can help those with tinnitus. This is no secret to an audiologist like myself, but most people overlook this. It's confusing because when you have a tinnitus problem, you want to solve the tinnitus. And often you can go get a hearing test and you're told, oh, you have some hearing loss or your hearing is normal. About 80% of patients are told they have some high-pitched hearing loss. And 10 to 20% of patients are told test was normal, nothing wrong with your ears. Well, clearly there's something wrong with your ears if you have tinnitus, or there's something going on with your auditory brain because you have this tinnitus. So what most people forget or don't quite understand is that when we treat any hearing loss, it can help our brain reduce tinnitus. The damage to the cochlea, that cochlear tinnitus, it is related to a hearing loss, right? And if your hearing test came back normal, Well, I want to make sure we're testing high frequency audiometry and otoacoustic emissions, or OAEs. Those are specific tests that can give us a more holistic, comprehensive look at your hearing system. But regardless, knowing that if we have the proper treatment of any hearing deficit, that it will help your brain reduce tinnitus. Despite your hearing not getting better, your tinnitus can get better. And that's a really key point. There's people who have much worse hearing loss than you. For example, a high-pitched severe hearing loss, who they tell me, no, I don't really hear tinnitus, or no, I don't hear tinnitus. So it's not the cochlear deficit that's the only factor here. That means you can still have a hearing loss, but you can reduce tinnitus. Super important. Most people don't understand that. In 2022, a review from the International Journal of Audiology found that 68% of patients showed a significant reduction in tinnitus from hearing technology like hearing aids or other forms of hearing clarity boost. What that means for me is if your hearing test showed any hearing loss and you're looking for all that you can do for tinnitus, definitely try hearing technology. The ones that we use can address both tinnitus and hearing loss together. And that's ultimately what you need. They're just one device that you wear in your ears. They look like hearing aids. They're small, discreet. They can connect with Bluetooth, and they can blend in with the color of your hair or your skin. So don't overlook that. It's one of the most important points that a lot of you don't quite understand yet. So hopefully this video will help. If you're enjoying this video but have further questions and want some personalized guidance, I'm an audiologist, and we offer a consultation or discovery call with a member of our team where you can ask specific questions and get some answers. I'm going to put that link on the screen right now where you can sign up for a discovery call. You can schedule that. It happens via telehealth. We'll be able to talk to you very quickly and get you some help. So click the link on the screen right there. We'll be excited to help you out. Now, getting back to our video, how to reduce tinnitus faster and with less effort, let's talk about key point number 6, avoiding silence. You might think, oh, I just have to tough this out. Tinnitus is a mental condition. I can just get through this if I tolerate it enough in my home office or in my living room. I just need to distract myself and forget about this. Don't think about it. You know, that might be a normal plan or a normal thought, but in reality, you do want to avoid silence during your treatment period. I studied with the founder of tinnitus retraining therapy, in my opinion, still today, the leading tinnitus treatment technique available. It's a protocol to follow, which includes sound therapy, treatment, avoiding silence, and specific education about what exactly is going on between your ear and your brain so you can take power and control back of your situation. And my mentor, Dr. Jastroboff, who one of my patients referred to as the grandfather of tinnitus research, very impactful guy. We'll put an image here of Powell and I on the screen right now because we did meet in person as he's my mentor. One of the key simple things that you can do, which is quite easy, is to avoid silence. How exactly do you do that? Well, don't be in indoor quiet places. That means you can use sound therapy devices that are on your ears, or you can use a sound machine, or you can have some instrumental music playing in the background. During the tinnitus treatment period, to promote habituation, we don't want your brain to be hearing tinnitus in silence. It's a temporary part of this treatment period where by the end of the treatment, you won't need the consistent sound therapy. But during the process, I really advise you do. Having a sound-rich environment is one of the most crucial things. And if you set up your home environment correctly, then you won't be hearing tinnitus in silence for most hours. Why does a quiet environment typically exacerbate tinnitus? There's an analogy that works quite well, which is if you have a candle in a dark room, that's the only light you're going to see, and your eyes, your attention will focus on it. If you keep that candle on, burning, but you turn on some lights around you, even if it's just a little bit, suddenly you're not so focused on the candle. Similarly, when tinnitus is the only sound in the room, the brain latches onto it, focuses on it, and then it can trigger this spiral of anxiety, stress, worry, fear, ruminating thoughts, worst case scenarios, sadness around having tinnitus, not sure what to do with it, etc., etc. When we bring some other sounds in, it takes our attention off of the tinnitus and it puts it in the background. So that allows our brain to learn over time that tinnitus is not a threat, it's a background sound, and we can focus on what's in front of us. Some practical tips for maintaining ambient noise around you would be using music, perhaps radio or voices. I don't personally recommend having the television on in the background all the time, but having any sort of external sound can be helpful. If you have some street noise, opening the windows. If you have a fan, turning on a fan. The best thing would be using sound therapy. So if you have sound therapy devices that go in your ears, then you don't need to worry about avoiding silence, because if those are programmed properly, then they'll always work for you anytime you have them on your ears. But if you don't have those devices, then a good quality sound machine or even a good high quality speaker can have sound in the background. The reason we like these sound machines is because they don't rely on Bluetooth from your phone. They have an internal computer chip inside of them. So what that means is you can play the sound and it's inside of that device. You don't get interrupted with notifications or phone calls, etc., etc. So really helpful to have in your living room or your bedside table or common places that you spend indoors like an office setting. In 2021, a systematic review of 1,345 patients from the American Journal of Otolaryngology found that tinnitus retraining therapy was an effective treatment for tinnitus. And one of the core pillars there is avoiding silence. Let's jump to key point number 7. It's seeking specialized advice and treatment from a doctor. In my experience, there's a very important step here where very few doctors specialize in tinnitus. And unfortunately, those doctors, be them good people, can tell you things like, I think you just have to get used to it. There's nothing you can do for tinnitus. Here's a pamphlet. Here's some basic information. Just check in a few months if things are worse, and just reach out to me if you need me. Well, that's not what you need. That sometimes can trigger anxiety and make things worse. Having a personalized treatment plan is a difference maker. Like I said earlier, we need to first identify the root cause and then create a targeted treatment plan that identifies those root causes. Ear and Hearing Journal in 2022 argued that audiologists have the most active role in providing tinnitus treatment, which boils down to targeted sound therapy and CBT-style counseling techniques. I strongly agree with that, because you need a quarterback, you need a guide on this tinnitus journey through the ups and downs, feeling like you're going in circles, but really you're spiraling upwards on the challenges that come along the way. I want you to have support. I want you to know where you're going and know what to expect along the way. Have hope for tinnitus. If you need help with tinnitus and ringing in the ears or other similar symptoms, please consider using our team at Treble Health. We have the nation's leading telehealth service for tinnitus. It's a company that I created that's helping thousands of people every year. On the link right here, you'll see an option to book a discovery call where you can speak with a specialist from my team and start to learn about your options for tinnitus. So click the link right there, and we hope to see you at Treble Health very soon. I'm Dr. Ben Thompson. Thanks so much for watching this video.